We have a 72-year-old man who presented to his physician with symptoms of fatigue, night sweats, and was found to have splenomegaly on exam. That measured about 6 centimeters below the left costal margin. And his CBC demonstrated a little bit of leukocytosis with a white count of 22,000, hemoglobin of 9.7, and platelet count was perfectly normal at 255,000. The patient underwent a bone marrow biopsy to evaluate the etiology of the anemia and leukocytosis, and the morphology demonstrated clusters of megakaryocytes and 3+ reticulin fibrosis. There was also molecular testing for JAK2 V617F mutation, which turned back positive. At this point, the patient is diagnosed with primary myelofibrosis. Well, this case illustrates an older gentleman who is greater than 65 years of age, and here I'm going to focus the case relative to the International Prognostic Scoring System, which is an important method for us to estimate survival of this patient population. So it turns out that patients who have age over 65 years are given a point essentially towards that score. The second point is to say that the hemoglobin of 9.8 yet represents another point because the presence of anemia seems to be also a negative prognostic indicator in this patient population. And the third is simply the presence of constitutional symptoms. In this situation, it's night sweats. So if you added 1 point for each variable, then you have an IPSS score of 3, and this means that this patient has high-risk myelofibrosis. That translates essentially to a 2-year survival for this particular patient. This is not an unusual way for patients with myelofibrosis to present. I have seen a variety of patients who come in with, again, various clinical presentations. This would be one possibility. About a quarter of patients with myelofibrosis may not have any symptom, actually, believe it or not, but then 75% of them will. Other patients may present mainly with very high platelet count, leukocytosis, significant anemia, and some may just present with anemia. I think when you look at the CBC abnormalities in myelofibrosis, it tends to be the most variable of all MPNs. So in the beginning, you may end up with cytosis and a little bit of anemia, and as the disease goes on, you end up with more manifestations of bone marrow failure and cytopenias.